New York City does have an air pollution problem, as do most major cities in the United States, and for that matter, the mega cities throughout the world. In particular, our air pollution problem revolves around particulates or small particles, also known as soot, and especially the very small ones, which are most easily respired into the lungs. One of the concrete things that the city has done over the last 2 years, and this again is part of Plan NYC, is to understand better how much air pollution there is in New York City and how it varies in different neighborhoods. Right now, the air pollution monitoring in New York is done in compliance with federal standards. It's on rooftops and it's spread throughout some 15 or 20 different locations in New York. Of course, we don't live on rooftops. We spend most of our time either in buildings or at street level. So the question then is, what is in the air that we actually breathe most of the time? So the New York City Community Air Survey is new, and it's intended to characterize the major air pollutants at street level at a large number of sites throughout New York City. The role of people at Queens College in this project has been to develop the basic plan of the New York City Community Air Survey. Secondly, we have developed the air monitoring unit, which we're putting out in the field. The design of the unit, what it contains, what batteries to use, all the very important details that ultimately determine whether this project succeeds or fails. Queens College has the field teams that are going out there every 2 weeks, putting these units up, harvesting them after 2 weeks, and sending the filters off to the labs for measurement. And then we get the data in. We quality control the data, and then it goes to the health department where much of the statistical analysis is done. What's different about this project is that we will be looking for the first time at air pollutant levels at street level, and also we will be doing a greater number of sites than ever before. In this survey, we will develop a more precise understanding of how air pollutants, and particular air pollutants, differ from one neighborhood to the next. We will be able to match that up with certain health outcomes. We know where asthma occurs in New York City. We know to some extent, to a lesser extent, where people with emphysema are in New York. We know the emergency room and the admissions for these various diseases, lung and heart disease. And we can use this more precise air pollution or exposure data, match it up with the health data, to develop a better understanding of the degree to which these pollutants contribute to health, and then one step further, the degree to which if we can lower these pollutants, we can improve people's health.